Well, hello, I'm Dr. Sherman Silber, Infertility Center of St. Louis, St. Luke's Hospital in St. Louis, Missouri. And we're going to have a great Facebook Live show tonight. Real treat for you. You know, I always answer questions from everybody, anybody out there infertility, and really enjoy the chats. But first, we've got two special guests who are just going to tell you a little bit about their experience, which I think we'll all learn from. But in addition to that, I'm just going to start out right now for 1 or 2 minutes to tell you about an amazing case we had last Friday, and it tells you why we were successful with Ashley and many other people. But this was a 21-year-old woman. Uh, she's in college, so you might even call her a girl at this point. But when she was 5 years old, she developed AML, which is uh, leukemia, acute myelocytic leukemia, and that's very, very deadly and kills very quickly. So at age 6, she had a bone marrow transplant. She's from New York, and she's totally open to us talking about her case. She couldn't come tonight because she's got a class tonight, but she was cured with a bone marrow transplant. But they never froze her ovary tissue before this, and so she was sterilized by the bone marrow transplant. And so she never went through puberty. And when she was 17, I guess they just decided she has no eggs, and they tested her. Her AMH level was undetectable, and no periods, and so it was pretty clear from everything. And the ultrasound showed nothing. No, I mean, they didn't even show ovaries really, except for a little streak. And so she assumed that she was totally sterile and had nothing. But almost on a lark, when she was having a follow-up appointment for her cancer at Sloan Kettering, after she'd gone to several IVF centers with her mother, and they all said, "There's no eggs left, so we'll just keep you on birth control pills for hormone replacement, and then when you become older, you can use donor eggs." But she called us just to see, and I told her almost the same thing. But on the other hand, what I did explain is if you know how the ovary really works, then you have a different approach. And most IVF centers don't know how the ovary works because they haven't done in vitro uh, production of eggs from skin biopsies and stem cells, and they haven't done in vitro maturation, and they actually haven't done ovary transplantation. So they haven't done the studies that allow them to really understand how the ovary works. So when your number of eggs goes down, the rate of primordial follicle recruitment goes down. And when the primordial follicles are recruited, they take about 4 or 5 months before they're even sensitive to gonadotropins from the pituitary. So when you ovulate or menstruate, that's with an egg that first was recruited 4.5 to 5 months ago from what's called the resting pool, the primordial follicles. And that recruitment from primordial follicles rate goes down when your number of eggs goes down. And it's a compensatory mechanism to let your ovary try to last longer. So at some point, you have so few eggs left that you have no recruitment, and it looks like there's nothing, but there are still some eggs left in your ovary. And if they're only 21-year-old eggs, then they'll be very fertile eggs. So anyway, she finally came. We decided to do mini IVF because that's the only way we'd get anything. If we get that huge amount of ovarian stimulation, we've studied this, you won't get anything. But we did a mini IVF protocol, and sure enough, a follicle showed up a little late, but it showed up. You have to be patient. And so we retrieved from the follicle just Friday, and we didn't know if there'd be an egg in there even, but there was a beautiful, mature, fertile looking egg. We froze it, and she's going to come back and do more, and we'll save up these eggs so that when she's 35, she certainly won't have any eggs left, but she'll have great quality fertile eggs saved up for what she wants to have a baby. Now, when we saw that there was an egg in that follicle, the whole operating room broke into a cheer. It was as though the St. Louis Cardinals won the World Series in the ninth inning and the seventh game with a home run. It was so much. Everybody was thrilled. And when we went back to the room, she woke up and we told her and her mother. Everybody in the waiting area cheered. Everybody was excited. All the nurses. I don't mean the waiting area, but the nursing area. It was just a thrill. But what it demonstrates is that when you think there's nothing left and you're close to premature failure and you're running out of eggs, there are usually some eggs left, and we can only get them without ruining them by doing a mini IVF protocol. So that was just my introduction. We're so excited about her. I guess I won't mention the name because she's not here, but she wants everybody to know about this. She said she'd like every cancer patient to know about this. She'd like Sloan Kettering to know about this more than just the nurse. This was a nurse. Everybody told her to forget about it. The nurse said, go to Missouri. And she almost wondered, where's Missouri? You know, I'm in New York, the center of the world. What's this Missouri thing? But the nurse said, no, you really have to go to Missouri. And it paid off. So now I'd like to introduce Ashley, just a great human being. And she's agreed to come here on Facebook Live and tell her story. It might be of use to other people. Hi, Ashley. Maybe just introduce yourself a little bit, and I'll ask you some questions.
Well, my name's Ashley and from Michigan. And I'm now 30, just turned 33, and I have a 3-year-old son from Dr. Silber.
Well, so Ashley, let me then tease a few things out of you. First
Sure.
place, I would like to say that I'm a little bit from Michigan because I've spent 11 years of my life in Ann Arbor studying at the University of Michigan. So I feel any Michigander is we're all Michiganders. But Ashley, what did you went through a lot before we saw you? Maybe you
Yeah.
didn't even know we existed. So just tell me what it was like.
So when I was 21, 22, I went, um, well, let's start here. Altogether, I've been through 7 rounds of IVF. Started when I was 21 years old, here in Michigan. I did, I'm just gonna, just give you a little rundown of what all we did before you, or, um, so started out in Michigan. We did four transfers with the same doctor. Um, I had a ton of eggs, ton of embryos each time. Um, the la- After the third transfer, our last and final transfer with this doctor, we transferred my young naive self 4 embryos, all B's and C's. Ended up having a almost fatal ectopic pregnancy from that. I had to get blood transfusions and all of that. Um, and also ended there with the doctor asking if we wanted to use a sperm donor. So none of that seemed like, why would we need a sperm donor? But I was very young. Um, then we went to a different doctor in Michigan in Dearborn, and we did 2 cycles with her. Um, After my second transfer with her, we still got, a lot of eggs, a lot of embryos. Um, just the quality was never right there. We did get some good embryos, but just no success. And then the one thing I did want to mention that I don't know if I told you, Dr. Silber, is that my last transfer with her, directly after the transfer, without even telling me, she straight cathed to get, empty my bladder. And I about jumped off the table. I didn't remember if I ever told you that, but
No, I didn't know that.
so after that, I was just like, okay, I was kind of just really down, and my husband took over and was just looking on YouTube, and he told me that basically he had found you, and he does, less hormones, less everything. And I'm in my mind frame, I'm thinking, no, I need more everything. I need more, more, more,
Yeah.
and so that's kind of where it ended off with you. Um,
Yeah,
so yeah,
because the usual thing is unfortunately that the knee-jerk reflex reaction of the physician is we better give you more hormones, we better stimulate you higher, give you more
yeah,
gonadotropin to get better eggs. But of course, the opposite is true. And
yeah.
so, go ahead and tell us what happened then.
Okay. So after I just put complete trust in my husband that, this is what we need. At that time, you weren't doing like Skype type interviews or Zoom. So we flew to you, and just sitting down, we flew to you, and you said, okay, this is what needs to be done. Very direct, but in the most, I don't know if it's the right word, but loving way. And that's exactly what I needed. No more testing, no more nothing. It was just like, okay, is this real?
So
And
it sounds like you spent a fortune on unnecessary testing and all the transfers and all the IVF cycles.
oh my goodness. I have a close friend going through it right now, and I'm like, no, 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 you don't need all that. But it's hard to believe, to other people, genetic testing, I think we did that almost every time.
And you
Um,
do know that that's bogus.
yes,
All
I
the
do. I
controlled
watch,
science has shown it's bogus, yeah.
yes.
But it
Um,
costs a lot.
it does, and it makes you wait a while. And so I came to you, and you were just like, okay, this is, what we're gonna do. And being through so many rounds, my hormones were all over the place. I was kind of a crazy woman. And with you, I was just myself, taking the medications, just some pills and a couple shots, and that was it. So
I knew you as just a sweet, kind young lady. I didn't know you was hormonal.
I wasn't with you because I wasn't being given so many meds. It was it was almost effortless. I hate to say that because, a lot of people say it is very difficult to go through IVF, but with you, it was just, I, I mean, can't even get words. It was so easy compared to I don't know what you call it, standard IVF, not mini IVF. So, um, and then with you, so I've probably had over 20 embryos. With you, I got one embryo, and one embryo worked the first time. So
And we didn't have to do this bogus genetic testing to get a good embryo.
no, and I didn't need volume before my transfer. I didn't need anything. I was just totally relaxed, more than with the volume. So, you know, it was just, it was absolutely incredible.
Well, it's fantastic. I'm glad you're telling your story to everyone because it's really a common issue and we bring it up. But and I've given talks all over all the time. I give talks to universities and to meetings, and it's very hard for most of the IVF doctors to really understand this. Maybe because they haven't had experience with in vitro gametogenesis or with ovary transplantation, and so it's crazy. And this genetic testing thing, it's not really genetic testing, it's chromosome counting because you have 23,000 genes, and that's only 2% of your genome. And so there's hundreds and hundreds of thousands of DNA regulators. And so we don't really understand. There's no way we can do routine genetic testing, but patients are led into believing they can. And all you're doing
Yeah.
is chromosome counting, and it's totally bogus because there's a variety of euploid and aneuploid cells in all early embryos.
Yeah.
So we didn't tell, and the studies now have come back showing that the pregnancy rate and the baby rate for a embryo that was biopsied and diagnosed as euploid is no different than an embryo that was never biopsied. You
Wow.
proved that.
Yes.
So tell us about the baby and about your early experience, because I also want people to know how important the early years are.
So I had just uh kind of just watched you, and I watched pretty much all of your videos, even if you're skiing or going to Africa and studying animals in the wild. It's like therapy to me. But so my son, his name is Zayden Sky, and he is 3 years old. And I had the opportunity through COVID to stay home with him and to nurture him and just love on him. And I'm a nurse, but I stay at home with him just to make sure he has. I mean, I may not be the smartest person in the world, but I think just being able to have this time to just truly love and give him all my attention it's he's the sweetest thing ever in the world. And
So COVID was, in a way, a blessing for you.
it was.
I don't remember. Did I give you my usual lecture about the first 3 years of life, or didn't you hear that from me?
I had heard it from you, but I think I watched it on one of your
Oh, okay.
YouTube things, or it was probably you, yes, in person. But
Yeah.
yeah, I took it to heart, to say the least. And every
But,
day, pretty much, I've been with them. So
people, they have to make a living, and it's a two-family income usually nowadays. And And it's very hard to sacrifice that income, but you were forced to really because of COVID.
Yes. Yeah, and it does kind of make you feel like, with the way society is, that, that you almost don't have a purpose being a stay-at-home mom, but it's the greatest purpose, in the world, so um yeah.
I often say that we have so many problems in society. I mean, it's getting crazier and crazier. And I often say that if we just either did away with daycare and everybody stayed home, or if we made sure we really trained the daycare personnel and funded it properly, so that you had a ratio of maybe 1 to 4 instead of 1 to 10, and they really understood and all about early childhood, and they were loving and caring, that we'd solve all the world's problems, because it's all in the first 3 years of life that kids get messed up.
Wow. Yes.
I'll share a little, since we brought this up. I'm just going ad lib. We didn't plan anything. But,
Okay.
my parents had a very difficult time. I was born just at the beginning of the Second World War, difficult time. And they were, very, very troubled and neurotic. So they brought me to, you might call it an orphanage. It was a family service, but it was a great place. Really fantastic, loving people. And I spent the first 3 years of my life there. And then they came back to get me. Now, it was difficult growing up because they were a little bit nuts, but I love them. They were really, I mean, they could have really messed me up, but those first 3 years really did it. That was where it's all at. And there have been books written about that. Selma Freiberg, a psychoanalyst in San Francisco years ago, I mean, she's passed away now, but she wrote a book called The Magic Years, and talks about how you can throw any problem you want at the kid after they've had a good first 3 years, and they'll be able to solve it. But
Wow. I've heard you mention it a few times over the years, just watching things, and I'm like, this must be very important if he keeps saying it.
that
So,
was right, exactly
yes.
right. But the scientific studies have showed I'm right about that. Yeah.
Yeah.
Well, this is great. So, what are you going to do now? Are you going to eventually go back to work or just hang out at home?
I'm thinking about going back soon, within the next few months.
And I think that's okay, because
Yeah.
you've really done the big job. Of course, parenting is never over. I guarantee you that. I'm still parenting, parenting my 50-year-old, 43-year-old kids. But nonetheless, you've done the major work right now. The rest
Yeah.
is just clear sailing.
Awesome. I did want, if you don't mind, I did also want to talk about also to your nurse Dina, if I could mention that.
Yeah,
Um
she's great. You can give her all the publicity you want. She's a
okay. So that was the other thing, is that I was like, before meeting you guys, I was a ball of nerves. Just, you have everything invested into it. And I've had nurses over the years make medication errors with what I should be taking. Um, just not prompt responses. And being in Michigan and St. Louis, I felt a million times closer to my nurse Dina than I did with nurses in my hometown. She she already knew the troubles I was coming to her with, and she was absolutely the most amazing. I want to be a fertility nurse one day because of her.
Well, moved to St. Louis, and I go by character. I don't even think about what training you've had or your CV, and we'll hire you. You've got a job if you move.
Don't tempt me, because I'll be on the next
You'd be
flight.
awesome.
Aw, thank you.
Well, all right. I think we ought to give Brittany a little time now, if
Okay.
she's still there. It's so great talking with you, Ashley, and I love hearing from you because I'm so busy. I don't get to keep in touch with my patients that way. So,
Yes, yes. Thank you so much.
oh, it's great to see you. Give my love to your husband, and of course, give little baby a hug for me.
I will. I will. I do all the time.
Okay,
All right. Thank you so much.
you're welcome. So
Bye
let me
bye.
tell you guys a little bit about Brittany, and I'm just a brief introduction, and Brittany's going to tell you her story. Now, she is an extremely charismatic woman, an actress, very accomplished, and her mother was incredibly charismatic also. And what a shock it was for her to find out she had breast cancer. and we had to act fast. So maybe we can put Brittany on and she can sort of tell us her story.
Hey, Dr. Silber, my fave.
I'm
My
so glad to see you, Brittany. You
Good
are
to see you too.
truly, I don't want to embarrass you, but I think you can deal with it. So it's not fake charisma. It's your heart is so beautiful.
I think big open hearts recognize other big open hearts. You know, you said to Ashley, I can't keep up with my patients the way I want to. Well, that's because you're out giving a priceless gift to other people. So if we have to trade, not being able to keep up with you for what you're doing for other people, it's kind of even trade off.
That's
So
fantastic. Tell us your
I'm
story.
really glad to be able to give accolades to you and to your entire team because really what you guys are doing is life changing. I was diagnosed with breast cancer on July 7th of 2022. Um, and everything happens really quickly. Everybody has this idea of what they would do if they were ever diagnosed with breast cancer. But trust me, unless you've had experience with it before, someone in your family has experienced it already, you're going to just move as quickly as they make you. And let me tell you, they make you move fast. They like shuffle you into this pattern that they've already set. And they kind of fearmonger you into making decisions really quickly. So the first decision that was made that I thought was a good decision, and I still do, was I had surgery fast to get the lump out. Um, what I didn't know is that once you have surgery, if you have the kind of cancer that requires chemotherapy, they need to start chemotherapy within 8 weeks after surgery. So my surgeon was fantastic. He got me in relatively quick. I mean, I had surgery on like the 29th of July. So just weeks after I was diagnosed, I had the cancer out. And at that point, I was no evidence of disease. However, when I met my oncologist on the 18th of August, my whole world came tumbling down. Um, he told me then we had to start chemo, we had to start now, and he was not going to give me time to preserve my eggs. So I'm now 37. I was 36 at the time, and I'm not married. I don't have kids yet. However, that is something that I want to do.
Let me tell you, some man out there is really missing out. Go ahead, though.
So this was it was mind blowing to me because the oncologist, not only did he act like it was just insane that I might ask a woman in her childbearing years that has cancer is definitely going to be concerned about her fertility. But what I find is that there are some doctors that are like, well, yes, I understand quality of life, but this particular doctor was more like, let's make sure you have a life. And I understand what he's saying. But if you're someone who wants to be a mother, what is life without the option or the opportunity to have kids? Now, if I don't have kids on my own, that's fine. But to feel like cancer snatched that away from me and this doctor snatched my opportunity is so very different. So I found out about Dr. Silber in the craziest way. I was not secretive about my cancer, not because I wanted pity or anything like that, but just because I feel like when you have conversations with people about what you're going through, magic happens. And oftentimes, someone is going to offer something. I got so much information about different like vitamins or different ways. And oftentimes cancer patients are not open to things that people suggest because it gets annoying. But I was at a gym and I shared my story with some ladies that I buy waist beads from. And they shared my story with an IV therapy nurse. That IV therapy nurse, after I worked out, came out and she said, you need to look up Dr. Silber in St. Louis. I was like, huh? She was like, I think he helps cancer patients. I'm not really sure, but I know he does fertility stuff. Just look him up. I said, okay. All I did was open up a Google Chrome window, typed in Dr. Silver's name, and I said, I'll get to that later. That was 5 days before I found out that I was going to have to start chemo immediately. So my sister had a wedding on that day. After the wedding was over, I go back and I just go into the rabbit hole. I find Dr. Silber on YouTube. I look through his website and I'm like, oh my gosh, who would have known that just sharing my story with some people that I work out and buy things with would lead me to the pioneer of a fertility treatment that is going to be the thing that I need. I'm certain of it because I don't have a husband. So who am I going to make embryos with? Nobody, right? there's no embryos to be made, right, Dr. Silber?
Right.
So that night, this is where the power of what you guys do comes in. I sent in a request for information and I said it was urgent. And Kelly messaged me back with a date in October 4th. I won't forget it. And I said, I'm sorry. This is really urgent. They're trying to make me start chemotherapy like right now. And Kelly messaged me back, oh my gosh, I'm so sorry. I'll see you next Thursday. That was August 25th. So we have a Zoom call and I mean, I'm greeted by the warmest spirit ever. Ashley said, I don't know if loving is the right word. Loving is the right word. That's exactly how I would describe Dr. Silber. He came on and we just had a conversation and it was a choice. He told me, he said, I have a friend that works in real estate and they told me that within 60 seconds, the person knows if they're going to buy this house or not. And he said, when you got on, I knew. And I felt the same way. Like, this is the person who I know I can trust my fertility with. And that's what happened. Dr. Silber was on his way to Israel.
Yeah, that's right. I remember.
He was leaving on August 30th. It was August 25th when we had a conversation. I was in Portland, Oregon, working on a show. And they said, if you can get here Monday, we will help you out. And that's exactly what happened. My mind was blown. Not only that, Kelly had very specific, easy directions for me to follow. Everything was set up. I didn't have to worry about anything except for getting to St. Louis. And that's all I did. And you guys took care of the rest. I've never been in such good hands. I mean, from every person that I was handed off to, and I was handed off to a lot of people before I actually got to see you. It was the perfect morning. It was just, I knew I was okay.
Fantastic. You know, I believe it was the next day I had to go to Israel.
It was the very next day.
I said, if we can just do it, was it Monday or Friday, whatever it is.
Monday.
If you can get here in time for Monday, which I thought was really asking a lot, we can do this. And you were going to start chemo, I think the next day or 2 days later.
Yeah, it was actually like the next week. And it just worked out so amazingly. Like I had that surgery that week and then they put my port in the next week and started chemo. I was just under the knife the whole time.
Yeah, well, that's important that you didn't have too much pain afterwards that would interfere with your starting chemo.
Nope, I was okay because, right after that, I laid down for a few days. You gave me that the long lasting, what is it?
Yeah, we gave you an anesthetic that lasts 2 to 3 days.
Yep. And what that did was allowed me to get back home to rest and not have to move around too much. I actually was able to get out of St. Louis that night.
I know. But it's funny that long acting, it's a local anesthetic. It's not just, you can't really purchase it. It's a combination of ropivacaine, which you purchase, Toradol, which you can purchase, and morphine. And Toradol and morphine, they can work on your brain for pain relief, but that's very inadequate. But when you inject it in the surgical site, the receptors hold on for 2 or 3 days. And that was first discovered, you never know where the best ideas are going to come from. That was discovered by an anesthesia department in University of Cork in Cork, Ireland. You never hear about, you don't know where the greatest new discovery is going to come from. So
yeah, it was perfect because, the next day I was like, if I would have stayed in St. Louis, I would have been in St. Louis for the rest of the week.
Well, this is great. So, I mean, your story is going to help a lot of people because you're right. Cancer patients are rushed, and most of the oncologists aren't really aware of what can be done to preserve your fertility. And I believe we have the only ovary freezing program in the country with transplantation to prove that it works because we started this in 1997.
Well, here's something beautiful. Well, first of all, I finished my chemo yesterday, so I
Great.
get to ring the bell. And that's done. But it is so unheard of. The doctor that I talked to first was like, I've never heard of that. I've never heard of someone freezing an ovary. Do you mean eggs? You must mean eggs. I said, no, I'm telling you. So you got your eggs taken out? No, I had a whole ovary taken out. Do you want me to show you a picture of it? Because I have it.
We have pictures we can send you if you don't have them. But it, if we were to try to freeze your eggs, it would be IVF stimulation. It would be a month later, and they're not going to give you that kind of time. I mean, we could freeze your eggs too, but we just didn't have that kind of time.
Yeah. And you guys taught me so much about how the body works. You know, you were saying earlier, people don't do the research. Just generally, people don't really know how an ovary works because I think we all think that we're running around here with a sack of eggs just in there, just jingling around. And that's not it.
Even in fertility centers, I have to say they don't really know how the ovary works really well. And that's because you need to have experience and studies. Well, we've written these all up and reported them, but still, often the fertility center just thinks we'll give you gonadotropins and we'll get eggs, we'll retrieve eggs and freeze eggs. And I mean, we actually developed the technique for freezing eggs as well as freezing ovary tissue. But you can't just do this, I think, robotically, like a robot. I think to really, well, any kind of medicine, I believe you have to understand the science.
Mm-hmm.
You can't just be clearly a clinician. You have to be a scientist too.
Yeah. Yeah.
But you're such a loving person. How are you doing? How is your acting? Has that been on hold for a while or?
So with my first portion of chemo, I finished the show that I was working on. So I started chemo in September, and the show ended at the end of October. So I had 4 treatments, 4 of the hardest treatments. They call it the Red Devil during that time, and I continued to work. And what I know now is that this is so mindset based. And I'm grateful that I gave myself that challenge because the chemo was very difficult. And if I didn't have any reason to get up, I may have wallowed in my sadness about the fact that, I'm the one that has to have chemotherapy. But I had to get up and I was able to live through the energy of my character. I know that sounds all woo woo, but she was very active and fun. And I was able to use that, and get up every day. So I've been very healthy. After 16 infusions, your body is tired. It's been over the course of 20 weeks. My body is tired of it, but I still work out. I still see my friends. My hair is already growing back.
Actually, I must say, although you were beautiful with your regular hair, this is very stylish. I like the look of this too.
Thank you. I got a lot of compliments about my bald head. I was really grateful that I had a good head shape because you never know. It's been a ride, but and I wouldn't tell anybody to sign up for it, but I've learned a lot. I've gained a lot. I think that if you allow it, cancer will teach you some really important lessons about life and its value.
Now, let me tell you something ironic. You're 36 years old then. I don't know if you've had a birthday since then or not.
Yeah. Mm-hmm.
But if you never had cancer and you just waited because you didn't meet the right guy or want to have kids until you were 40, you'd be infertile and you might not ever have a baby. I mean, we do IVF with women as old as 47, but the results really go down dramatically between the ages of 36 and 40. And so it was maybe, I don't know if you're religious, but it was a blessing, really, a disguised blessing that you had cancer.
100% a gift. I tell people all the time, like, oh my gosh. Now I can stop being weird on dates with these people and I can just have a regular dating process because I can still have a baby when I'm ready. I don't
Yeah.
have to rush the thing, you know?
You don't have to marry the first jerk you meet, you know. You can- You're free to make an intelligent decision, not a rush decision.
Exactly. It really is a gift. And you said while I was there, if I was a king, I would order every 25-year-old to have this process, this procedure done. And it's so true. Like I wish I would have known, right? Like that this existed. It unfortunately took tragedy for me to find you. And if that's what happened, then so be it.
So COVID was a special blessing for Ashley, and cancer was a blessing for you.
Absolutely.
It's amazing,
Absolutely.
really. God works in strange ways. We can't know what He's on His mind.
Seriously.
Maybe I should say her mind. I don't know. I don't want to irritate the woke culture.
It'll go down. They'll be like, cancel him, cancel him. Yeah,
Uh,
but I
this,
thank you so much. You really are doing priceless work. I cannot thank you enough.
well, the thanks is just from knowing that, knowing you and knowing you're going to have a great life. And who knows? I may not even be around when you finally get married and have a baby. I mean, that ovary is going to be 36-year-old, even when you're 100. So you can
No,
have a baby at any time.
you have to be around because you're gonna have to interview him.
I'll do that. I'll do that. There's been a lot of studies, and this isn't so relevant, but you talk about your purpose and being your character, and a lot of studies show that you live much longer if you have a purpose.
Mm,
It's neuroradiology. They can image your brain and see that your axons are less likely to deteriorate if you've really got a purpose that you care about. I mean,
mm.
it's not. It sounds woo, but it's not. It's very well documented now with the new imaging of the brain.
Well,
Yeah,
thank God that I found things that I love and that I want to be here for.
that's right. Exactly. Yeah, yeah. He'll usually give you that extra time if you've got something good in mind.
Well, I better keep coming up with more and more for this list. Like I gotta work on this, and now I need to work on this.
Well, this is great. I believe our time's up, but I want you to continue to let me know how you're doing.
I will.
You look beautiful. You don't look like you had chemo. I mean, I'm just floored by you. Just don't look sick at all. I'm really excited.
Thank you. That was my goal, to not look like a cancer patient. I managed to be all right about 17 out of the 20 weeks. There was a couple weeks I was like, I didn't make it. I look like a cancer patient today.
It's miserable, isn't it? Yeah, it's really miserable. So, and that's it. You're done with it now completely. Is that right?
Yeah, I have to follow up with radiation, but is nothing compared to the chemo.
And they're going to let you get pregnant in 5 years. Is that the rule? Or?
Well, luckily for me, mine wasn't hormone based, so that's not a.
So they don't even care. Yeah.
Mm,
Okay, that's fantastic. Well, you're going to be a great mother because that's what it takes. It takes a loving heart. And your mother was a fantastic mother because I queried you about her. I remember that.
yeah, my mom.
I always wonder, where does this kind of a soul come from? Well, it came from your mother.
Absolutely.
Yeah.
Absolutely.
Well, okay. So I think it's time to sign off. We've been here for about 40 minutes, and I'd just like to say that this is Brittany Caldwell, actress extraordinaire, who is telling her story about fertility preservation and cancer. And I'm Dr. Sherman Silber, Infertility Center of St. Louis. You can write at infertile.com, or you can call us anytime. were easy to make appointments with. And I just love what I'm doing. I'm kind of an old guy, but it doesn't matter. I feel young. I swim a mile every day. And what keeps me so vigorous really is just that, the first commandment is be fruitful and multiply. And so that's what I'm trying to work on. Okay, so it's great seeing you again. We'll stay in touch.
Yes. All right. Thank you.